Hello, I'm happy to give a presentation for the BEST program today that deals with surgical innovation, a very important topic, and concept creation. And I subtitled this as the surgeon's third job because I really think it's something surgeons have to be actively involved in for the furtherance of our science and just to keep surgery interesting for the practitioners. In my view, the complete surgeon is not just a clinician that operates on patients. It's somebody who does good surgery, good clinical care of patients, and somebody who is involved in teaching, that teaches the next generation of surgeons. But also there's a third element, which is research, which is furthering our discipline, which is carrying it on and doing it better and better as time goes on. Now, research can be both basic science for the advancement of our knowledge, better understand how the body works and our interaction with our environment. But it can also be innovation, and this seems to be something that surgeons are particularly interested in as well. And this is really to improve the way that we practice our disciplines, improve how we practice medicine. And I think innovation is a big part of that, discovering a better approach to everyday diseases or treatments or how we practice surgery. It's going to be understanding of the disease mechanisms, how diseases work or how our body reacts to them. And it can also be, and traditionally has been, anatomic discoveries. And of course that was something that was much more common in previous centuries than it is today. There's not that many new anatomic discoveries, obviously. But there are always new concepts that come out, new concepts how we can approach diseases, new diseases on occasion that come up. And certainly that remains very relevant as well. Just to step back and kind of look at the history of all this, and there's been a variety of big surgical movements through time that certainly are very relevant to consider. In the 18th century, kind of at the birth or the dawn of surgical care, it was really about understanding human anatomy, how parts interconnect, how the body works, what the organs were. And we saw all the great anatomists at that time working. In the 19th century, it was really about how to operate on diseases of the body, how surgery can impact disease process. At that time, it was rather hit or miss whether the patient would survive such an intervention, but we started seeing things like removing gallbladders or draining appendiceal abscesses, operating on breast tumors was the great era of that you could actually intervene in a disease process for a curative intent. 20th century, I think, hallmark is that we really could surgically cure patients, surgically treatment of diseases without doing the patient harm, that we can intervene. This is the era of maximal access, big incisions, radical treatments of diseases, and learning how to reconstruct things, not just drain abscesses or extirpate diseased organs. So now on to the 21st century, I think what we're seeing in this time is no more new anatomic discoveries, really. We know we can operate on diseases and sometimes cure the patients. We can do huge 16-hour surgeries under anesthesia feasibly and without causing patient harm. But now we're in an era of refining surgical approaches using technology. And almost all new developments over the last 50 years have been technology-driven. This is from James Tonson's address at the American College of Surgeons a few years ago, where he described the greatest medical advances of the 20th century, specifically surgical advances: anesthesia, blood transfusion, surgical nutrition, organ transplant, cardiac bypass, and laparoscopic surgery. And I think what is notable here is that these were all advances that were very contingent on technology development and innovative technologies that made these possible. And that innovation continues today. And I think in this era, in particular, developing enabling tools for new advances is really what it's all about. And this is the source of innovation today. Not so much anatomic understanding, but tool development. And we know directly that the development of better tools, new tools, leads directly to development of new procedures, and we see that on a day-to-day basis, where with mini laparoscopy, hand-assisted, the list goes on and on. All these were contingent on having the appropriate technology available to enable them to be developed. So the concept may have started first, but the concept couldn't happen without the appropriate technology. So innovation today, and probably for the foreseeable future, is all about developing new innovative approaches, but more specifically enabling technologies. And it's just more examples of that. We all know these in laparoscopic surgery, that without clip appliers or staplers, a lot of things we take for granted laparoscopically couldn't have happened. So how about today's trends in innovation? Where are we at with that? Well, I think it goes back to really minimizing trauma, a long-standing desire of humans to have surgery without having gross bodily damage, without ending up in the hospital for weeks or months, and goes back even into the 18th century. This great quote by John Hunter, the famous surgeon: "Surgery gaining much from the general advancement of knowledge will be rendered both knifeless and bloodless," certainly is a dream of all humans, and where innovation has been focused over the last 20 years. We know that by and large, given their preference, our patients, the public, would really rather have their surgery done minimally invasively. And this is probably the grand focus of things in this day and age, either avoiding surgery or at least making it minimally painful, minimally disruptive to your everyday life. I think, in fact, you could say that the new goal for surgery in the year 2012 is that a person could go see a surgeon for treatment of a disease, not have to go to a hospital, go to a doctor's office or an outpatient facility, not have to have a general anesthetic, but just perhaps be sedated for comfort, have some sort of surgery that's very minimally invasive, perhaps even without any incisions or scars, go home an hour later and go back to work or caring for their family the next day. So our dream, our goal in this day and age that spawned developments like notes, that spawned interventional radiologic procedures, is certainly this very, very minimally invasive surgical treatment of disease. I think one of the other things, as we discuss innovation, that has to be kept in mind is that surgery more and more is less and less about the surgeon's hands and more about our technology, in particular computers, information technology, and how we interact with that. Image-guided technology is really the hallmark of where innovation is at in this day and age. Not so much training physicians' fingers and tactile knowledge, but really developing image-guided tools and computer-enabled tools. We can't forget some of the other aspects of innovation that we have to keep in mind, certainly in 2012. The ethics of what we do, increasingly conscious of that, cost-effectiveness of it, and even the return on investment. Innovation doesn't happen without somebody investing the money into designing new technology, and surgeons have to be aware that even if it's a great idea, if it makes no business sense, it's unlikely to ever see the light of day. Just a brief discussion on the ethics of innovation. This probably was little considered in the past.